I'm deeply honored to have been invited by Ruud de Jong, chairman of the Dutch Lynch Syndrome Patient Association, to deliver this video message for your 10-year anniversary meeting in Utrecht on May 14th. I feel absolutely certain that the more than 250 members of your association, coupled with many individuals who read HNPCC Lynch Syndrome Journal, are in full appreciation of what the Dutch Lynch Syndrome Association can do for them from the standpoint of diagnosis, screening, and management. Meeting as you do can help immeasurably in providing educational and emotional support to each other as a group. Indeed, this is the very basis for group therapy sessions. Spreading the word, so to speak, about prevention among your own relatives is essential. Some undoubtedly will have molecular genetic evidence of the Lynch syndrome. Some may already have benefited through early detection of colorectal cancer through participation in a colonoscopic program. And some of the women who are at high risk for endometrial and ovarian cancer may have benefited from endometrial screening and/or prophylactic hysterectomy and bilateral salpingo-oophorectomy once they've completed their families. Another benefit that will undoubtedly ensue through the long-term effort of the Lynch Syndrome Association will be that of expanding the recognition of the potential life-saving benefit to even greater populations that may be afflicted with the Lynch syndrome. For example, in the United States, there have been several organizations which have developed during the past decade and which in some respects have similarities to the ongoing movement by the Dutch Lynch Syndrome Association. Many patient-driven organizations, such as the international renowned Komen Foundation for Breast Cancer, and new organizations such as Lynch Syndrome International, work tirelessly to get the word out about hereditary cancers. These non-profit organizations not only raise awareness, but also help for needed funding in the interest of continued research in these very important areas of cancer research. These intensely motivated individuals have provided hope and cancer prevention benefit to an ever-widening group of individuals at risk for not only the Lynch syndrome, but moreover for a large number of other forms of hereditary cancer, such as the hereditary breast ovarian cancer syndrome due to BRCA1 and BRCA2 germline mutations. Such proactive groups have been persistent in request that the family physicians, oncologists, surgeons, and other medical specialties pay ever greater attention to the patient's needs to be heard and to encourage high-risk individuals into early proactive cancer prevention programs. For example, it is well known that many physicians do not do enough to help in the discovery and management of high-risk patients. They may not give appropriate attention to and listen to those individuals who tell their cancer family history story. If they did, it could result in a cancer genetic diagnosis that will not only aid the patient, but moreover, the extended, countless high-risk relatives. Finally, having been invited to your beautiful country on several occasions, and having received your well-known and most generous Dutch hospitality and friendship, I wish to tell you that I'm greatly moved knowing about the advances that have taken place over the past couple of decades involving countless medical and scientific advances in the Lynch syndrome. These efforts have definitely led to the saving of many lives. This invitation also provides me with the opportunity to acknowledge the tremendous clinical and basic research on Lynch syndrome, which has been conducted over the years by my friend and colleague Hans Vossen, MD, PhD, on behalf of this hereditary disorder. In my opinion, his efforts in concert with his team have resulted in one of the most highly productive Lynch syndrome research and clinical screening and management centers in the world. Congratulations to all of you for your involvement in this wonderful Lynch Syndrome Association.